Dr. Alex Spira with Virginia Cancer Specialists in U.S. Oncology. We're here at the World Conference of Lung Cancer in San Diego, September 2024, and I'll be talking a little bit today about some of the work we're presenting on the SKIPPirr study. So the SKIPPirr study is a study looking at how do we mitigate some of the infusion reactions from amivantamab. Amivantamab has several approvals already. It's currently approved just in the United States, very recently, with lazertinib for the newly diagnosed patients with lung cancer. It has a long-standing approval for patients with exon 20 insertion mutation, and we'll probably getting some other approvals soon as well. One of the challenges is that it's an intravenous drug and people can have infusion-related reactions with it. So shaking, chills, typical reactions that oncologists were very used to giving. And these are usually mild, you can still give the drug, but of course they're dissettling to patients and physicians as well. So this is a very straightforward study. It looked at a couple of different ways to help mitigate those reactions. One of which was giving dexamethasone pre-medications, one of which was giving methotrexate, and another was actually giving montelukast, the asthma and allergy drug. And what was basically found in the study, and I know it sounds very simple, but steroids actually helped. So the use of giving patients dexamethasone, relatively modest doses, can actually mitigate a lot of these infusion-related reactions. So that will be very helpful for our patients as they get this formulation going forward. Some of this will be a little bit less relevant because there's been very good data from what's called the Paloma study, looking at a subcutaneous formulation. That's not yet approved, but they're looking at the Paloma study to approve subcutaneous amivantamab in a slightly different formulation, and that administration mitigates a lot of these infusion-related reactions. So we hopefully won't be able to do that. We'll be able to do that soon, and that will be very helpful for patients, not only for the reactions, but for time. But until then, as well as places where you can't yet give IV formulation or will not have it in the future, giving steroids is actually found to be a very easy way to mitigate these reactions. So one hopeful way that help improve patient care going forward. So there'll hopefully be other studies as well looking at how do we mitigate some of these things. I'm just give you an example. One is called Cocoon. That's looking at a current study that's accruing to look at if we can prevent some of the rash-related side effects by giving people prophylactic skin care and medicines for the rash associated with amivantamab. So now that we have a new drug that's been approved for several new indications and hopefully more in the future, we're looking at ways to improve on outcomes, not just improving survival, but also mitigate some of the toxicities. Always excited about because it's a good chance to reconnect with friends and colleagues and hear about some of the new data. I'm really looking forward to just some updates. We're going to hear some updates on datopotamab, which is an antibody drug conjugate. They're going to show what may be a new biomarker, so I'm excited to hear about that. They're going to be showing some of the overall survival data in the second-line setting, which is currently sitting at regulatory authorities here in the United States, so looking forward to hearing about that. That's one of the things. There's also a PDL VEGF bispecific that they're going to be presenting some updated data from China on that really surprised us at ASCO, so we look forward to hearing some of that as well. So there's always some new interesting data, so look forward to hearing a lot about some of these new studies.